Our governor is Lynn Rapp Silver, and she's going to talk to you about nurse practitioners, and that will be followed by Bill Woolsey, Bill Woolsey Jr.
Hello.
Hey, Governor. My name is Lynn Rapp Silver, and I'm an APRN, a nurse practitioner, and I'm very concerned about access to health care for all the residents who are going to be newly insured come October when the Affordable Care Act happens. To be specific, there's going to be 400,000 new recipients for health care that will be having insurance. And one of the concerns in the area are several. Lack of primary care physicians and overuse of the emergency rooms. And APRNs can provide a lot of care to the city and town residents in a cost-effective and quality manner. Right now, there are APRNs who have their own practices in the state, and they're being threatened with closure because they have to have a written collaborative agreement with a physician. And there's a nurse practitioner in Windsor who has 2,000 patients, who is going to need to renew her collaborative agreement with a physician in a year because he's going to retire. And she has had trouble trying to find somebody to sign that agreement. There was another case of 30 nurse practitioners who give psychiatric services in New Haven. They have one collaborating psychiatrist, and that psychiatrist is going to move in a couple of years. And those 30 psych APRNs are no longer going to have a collaborating physician, and they're going to have difficulty trying to find a psychiatrist to collaborate. The reason why I bring this up is that we just had a bill before the Public Health Committee for APRNs to remove a barrier of practice, and it was part of the filibuster and was ending up not being able to be moved forward. And I just wanted to find out what your thoughts were about APRNs and the access to health care that we can provide to the residents of the state.
Yeah, I think about it frequently, quite frankly. The American Medical Association has said that we're going to have a shortage of 42,000 physicians in this country as a result of people aging out, of us not making enough doctors, and of a whole bunch of people having health care, which I support. I mean, I think those people should have health care, knock on wood, coverage. So I'm anxious about this. With respect to the 30 folks involved in the psychiatric, I would invite you to share some information on that with me. Again, a lot of this depends on what's in the bill and how that all works. As you know, and I think we could probably agree, because you have a particular license doesn't mean you're an expert in everything. And so there's a lot of details that have to be worked out. I think I don't think the filibuster had anything to do with you. It had to do with some other issues, legislative issues. Had nothing to do with me either. Okay. So I'm open mind on this subject matter. I come from a long line of nurses. My mother was a nurse. My aunts, a bunch of my aunts were nurses. My sister-in-law, mother of 11, is a school nurse. So this is important stuff. But a lot of it would depend on what's in the bill, and honestly, I haven't read the bill that was filibustered.
Well, I think one of the concerns that I have too, in this town, in this area, we've lost a lot of primary care physicians, and we do have a great community health center here. And unfortunately, they need that physician to be part of that process to stay in business. And most of the care that's done in that center is done by nurse practitioners. Yep. There's only one physician, and there's 8 nurse practitioners. Yep. So there is a big concern as far as access to health care and trying to get care.
So how many are there nurse practitioners in this community? Is the one, or?
That's the center right now. It's very
ones.
difficult for us to try to open up practices because if you have to have this written agreement with a physician, the physician has to know you or kind of have to have some sort of relationship. They have to be a like entity. And there have been situations where some of these physicians have actually asked for fees to collaborate.
Hey, Zach, you want to give this lady one of your cards? And if you want to correspond with me on this, I'd be happy to do it. Okay?
Thank you.
Thank you.
Governor,
oh, yes.
Speak. Okay, Governor, the next speaker is Bill Wolseley Jr., who wants to talk to you on the passage of laws. And the next speaker will be Reverend Dr. Peter Adu.